Hello. Here's an overview of the raw data that we use to create the statistics and the feature vectors that went into our modeling and machine learning algorithms. These objects here are 3D meshes, 3D surfaces of the interior surface of a patient's heart. These were measured by inserting a catheter, like going through this into the heart and then probing the heart surface from the inside. Whenever the catheter made contact with the surface, the 3D position of that contact was recorded. That's where these 3D surfaces come from. And also the catheter recorded the voltage that was expressed and measured at the surface. It recorded multiple values, including unipolar and bipolar voltages. In this case here, we are looking at the bipolar voltages. This here is the patient's left atrium. This over here is the right atrium. This was the primary target of the procedure, the cryoablation procedure. I'm going to hide the right atrium so we can focus on the left atrium here. The colors on the surface are color mappings of the surface, of the voltages measured along the surface. So these purple areas here, like this one, and then there's a little bit more purple over here, correspond to voltages of 0.5 millivolt or more. And these red areas here and here correspond to voltages of less than 0.1 millivolt. And then these yellow colors are voltages in between 0.1 millivolt and 0.5 millivolt. This gray area down here means that for some reason there was no voltage data collected, even though the surface itself was probed, which is why we have the 3D shapes, but we don't have the color mapping because no voltages were recorded. I do not know the reason for that, so we just draw those in gray. The idea here now is that we can not only look at a single of these surfaces, but in each of the procedures, at least two of these surfaces are collected. One of them is before the actual cryoablation procedure, and then there's going to be one or more after the cryoablation procedure. And this one here is the surface from before the procedure. So now I'm going to show and I'm going to overlay that with the surface from after the procedure. And as you can see, first of all, the 3D shapes, even though they're measured independently, line up very well, which is good because it is, after all, the same heart. We are hoping that it doesn't shift too much, that the measurement doesn't shift during the procedure. So I'm going to hide the pre-voltage mesh now, and what you can see is that there's a difference in voltage distribution. You can see this very big red area here, and you can also see that there's a lot less of that purple that we had before. So that means that during the procedure, the overall distribution of voltage is shifted from the purple end towards the red end. And these are exactly the kind of data that will go into the statistical method that we are developing. Specifically, we are looking at area fractions, meaning we are asking what is the percentage or the fraction of the complete surface area of the interior of the heart that corresponds to voltages of 0.1 millivolt or less, or to voltages of 0.5 millivolt or more. And so we are tracking these area fractions. So this one here is a large area fraction, meaning we'll be landing around 60%, and this here is going to be probably more like 5%. We are tracking those previously and after the procedure, and then also between all the different patients. So our data set of, currently 44 patients. We can also look at this a little bit more quantitatively by bringing up, and I'm going to first show the pre-voltage mesh, by bringing up a graph of the distribution of these measurements. And so in this graph, we have voltage going from, I'm going to stand over here, we have voltage going on the horizontal axis, where this is 0 millivolt, and then each of these ticks is 0.1 millivolt. So we have 0, 0.1, 0.2, 0.3, and so forth. And these vertical lines indicate the 0.1 millivolt threshold, which corresponds to the border between red and yellow. And then over here, the 0.5 millivolt threshold, which corresponds to the border between yellow and purple, which are the important voltage thresholds that we were looking at. On the vertical axis, we have area fraction. So this goes from 0 to 1 or to 100%, however you prefer it. And what this graph means is, this is essentially the analog to a cumulative probability distribution function, which means that the vertical position of this line indicates how much of the heart surface has voltages below the horizontal component. So in other words, if you look here, this would be 0.1 millivolt. Then if we track this 0.1 millivolt line up until it intersects the surface, then it means, if you now put this to the left, that this much of the surface is below 0.1 millivolt and this much of the surface is above 0.1 millivolt. which means that we have approximately about, I'm going to say 20% of the surface that is red as opposed to yellow or purple. And the same holds over here. This is the 0.5 millivolt threshold, which means that approximately, I'm going to say 90% of the surface have voltages below 0.5 millivolt and maybe 10% have voltages above, meaning that about approximately 10% of the surface is going to be purple. And so we can now compare these graphs between the pre and post scan. So if I bring both of these in, we now have the second graph as well. So the reminder, the blue graph here is prior to the procedure, the cryoablation procedure, and the yellow graph here is above. So what we're seeing is that the distributions are quite different, and a reminder that this is the bipolar voltage method measured by the device. Specifically, what you're seeing is that all of the voltages are kind of pushed towards the left side. We are noticing that now, instead of having 20% of the surface with voltages of 0.1 or less, we now have, I'm going to say, somewhere between 60 and 70% of the surface having voltages below 0.1, meaning that we're going to see a lot more red than we did before. If I turn off the pre-voltage mesh, then we can see that this here is almost, that this side of the heart is almost completely red. I'm going to bring the, whoops, not that one, not this one, this one. And similarly, if we look at the 0.5 voltage threshold, then we see that in the pre-procedure mesh we have approximately 10% of the surface values larger than 0.5, meaning 10% of purple, whereas in the post-procedure mesh we have, I'm going to say, probably 3 to 4% of the surface larger than 0.5 millivolt, meaning corresponding to the purple areas over here. And so this is the input data that gets fed into the prediction algorithm, which is the area fraction of the heart surface below 0.1 millivolt, the area fraction above 0.5 millivolt, and we are tracking those through the entire data set of 44 patients in order to essentially train a prediction model to not only tell us what type of atrial fibrillation we have, paroxysmal versus persistent, but also what the patient's potential response to the cryoablation treatment is. Thank you very much for watching.